Okay, so the third one that we want to take a few minutes to talk about are suicide and drug poisonings. This is a somewhat depressing series of slides because there's some really horrible statistics in here. But what we know is unintentional injuries are the leading cause of death between basically 1 and 24-year-old individuals living in the United States in general. And so there's a lot of things that contribute to that. Suicide and drug poisonings are really important contributing factors. There's also an overarching theme here, I believe, of mental health. And so mental health is another one you're not going to see as one of our 7 criteria areas. However, I do believe it's overarching in all 7 areas that we talk about, that mental health is influenced by that in many ways. The one thing to keep in mind about suicide and drug poisonings is they are completely preventable. And so that there are intervention strategies and things that we can do that have been shown to be effective. Clark County, we know, has a very, very, very high rate, 50% higher than the United States with respect to rates of suicide. Okay? And the impact of suicide on families is phenomenal, financially, emotionally, stability in families, and the list goes on and on, the impact that suicide can have. Basically, suicide is ranked 10th in the U.S. and 7th in Clark County as the leading causes of death, which is really, really high. So there's a really consistent theme here that every one of the metrics related to suicide is exceptionally high, and mental health problems are a huge concern within this community. Suicide is the 3rd and 4th leading cause of death among 15 to 19-year-olds. So these are high school age kids, which is also just a life wrecker for families, for communities, for schools. It's just unbelievable the impact they have. And 20 to 24-year-olds respectively between the years of 2004 and 2013. There are some susceptibility areas and some disparities that we do see, a little different than most of the trends we see on most other statistics, but actually suicide mortality rates among whites are almost 2 times as high as any other group. So I think that's important to keep in mind when we start thinking about intervention programs and how we may address that. And among 9th to 12th graders, Hispanic females are kind of our high-risk group, where they report higher rates of attempting suicide than all the other ethnic groups, including the black and white individuals within the schools. So poisoning is the number 2 cause of death of 20 to 24-year-olds in 2004 through 2013. Number 1, survey says, automobile accidents, right? And so just to put that in perspective, that's the scope and magnitude. It's up there right behind automobile accidents, which we know is very high. The number of drug-induced deaths has nearly doubled over the past decade. There's all sorts of things that go on in our schools and our communities, these things called farm parties, if you haven't heard of them, farm with a P, where kids all take their prescription drugs and throw them in a bowl and take a handful of pills and find out what happens. There's just some exceptionally scary things that are happening in the community. So drug overdose and death rates are about 70% higher than the national rates in 2010 and 2011. So mental health and suicide and poisoning have some pretty staggering statistics for us. Drug overdose deaths in 2010 are more likely to occur among males, American Indian, Alaskan Natives, or a person between the ages of 45 and 49. So we do have some susceptibility groups and areas where we may need to be targeting interventions if this is chosen as one of our priorities. I know it's tricky. All 7 of these things are priorities, right? And we're not going to drop them off the table. However, we can't do everything at once, so we do have to prioritize and choose. And that's hopefully what we're doing today is giving you some data to make some informed decisions about each of these 7 priority areas. So Victor and I are not in competition vying for which one of these is the worst. We all know we have issues in all of them.